What supplements should you be taking if you're trying to get pregnant? Hi friends, I am Natalie Crawford. I'm a fertility doctor and I am here to educate you about your body and help you get pregnant the fastest. Today I am talking about fertility supplements, medications, what do you need, what should you be taking if you're trying to get pregnant. Before we begin, a few reminders. Subscribe to this channel if you want to learn more about your body. That helps this message get to more people and helps us all out. Second is that I'm a fertility doctor, but I'm probably not your fertility doctor. I mean, maybe I am, but I'm probably not your fertility doctor. Therefore, specific questions should always be asked of your care team and your doctor. I don't know what other medications you're on. This is not medical advice. This is simply me educating you so you have good questions to ask for your own healthcare team. The third is that it's very hard sometimes to study vitamins and diet because none of this is perfect science. People who tend to take more vitamins and supplements tend to eat healthier and do other good behaviors. So there's a lot of confounding in studies. I'm just giving you a generalized overview so we can be armed with information. The first thing we always hear is that women need to take a prenatal vitamin. Now, if we were going to scrap it down to the bare bones basics, if you're trying to get pregnant, we recommend that you take folic acid. Folic acid is really essential in cell development. It's also really important for the brain and spinal cord function. So a deficiency in folic acid can cause something called a neural tube defect. And this is where the spinal cord doesn't come together and fuse completely. You can have spina bifida, where it's on the lower back, an opening in the spinal cord. It can lead all the way to anencephaly, where the brain is not fully developed. So these are very severe abnormalities that can be prevented with enough folic acid in the diet. So folate can be found in nature and in your diet in your leafy greens. So your broccoli, your spinach, asparagus, and then in avocados and in beans. For most people, it's not at a high enough level to get everything you need just from your diet. And so bread is now fortified with folic acid also. In order to prevent a neural tube defect, the recommendation is to take at least 400 micrograms, mcgs, of folic acid a day. So if you walk into a doctor's office and say, I want to get pregnant, the minimum you should be told is take a folic acid pill. Every prenatal vitamin that exists has folic acid in it. There's also debate in the medical field if methylated folate, which is a metabolized version of folate, is better than folic acid. Now, for most people, folic acid is just fine. However, for a subset of people, they may have a difficulty in this metabolism step. There is a gene defect called MTHFR, methylene tetrahydrofolate reductase, and in people who have deficiencies in this, they may have a difficulty processing folate. This has been inconsistent in studies. However, prior convention used to be simply to give people very high doses of regular folic acid, like 5 milligrams, and now is to stay at normal doses but recommend a methylated version of folate for certain people. So taking higher doses of just regular folic acid, if you did have MTHFR, is just going to back that up and not actually give you more of the folate that your body needs. So therefore, a methylated version is easy now to find in lots of different prenatals. And so that is typically my recommendation at least the equivalent of 400 micrograms. Number 2, vitamin D. Almost everybody is deficient in vitamin D. Women have improved fertility, specifically improved uterine function and implantation when they have better vitamin D levels. There was a study shown looking at recipients of donor eggs. So the donor eggs, they're all good quality, and women who had better vitamin D levels had higher pregnancy and live birth rate. This really was a landmark study for us that made us all look at vitamin D a little more seriously, since a huge portion of the population is vitamin D deficient. In this study, women had lower pregnancy and live birth rates when they had donor eggs if their vitamin D level was less than 30 nanograms per milliliter. So the recommendation is to check your vitamin D because some people have severe deficiencies that are going to require a prescription strength medication to replete it. Otherwise, almost everybody can benefit from about 1,000 IUs of vitamin D3. There are foods that are fortified with vitamin D, such as milks, your plant milks, your cow's milk, but almost everybody, I check every patient, has some level of deficiency. So definitely recommend an additional vitamin D supplement to my infertility patients, in addition if there's any vitamin D in their prenatal. Number 3, vitamin B12. not everybody needs B12, laying that one out there. But those of you who follow a plant-based diet like I do and who are vegan, you definitely need some vitamin B12 in your life. You can get B12 from some non-animal based product foods. Most B12 in nature comes from animal products, but your non-animal based products can be fortified. So some cereals, nutritional yeast, and some of your plant nut-based milks can have B12 in it. That said, taking the supplement is going to make sure that you have all the B12 you need, which is really important. You make sure you're getting what your body needs for cell function. Okay, what about the other stuff? So everything else is more disease-based specific. Talk to your doctor. Number one, CoQ10. Coenzyme Q10 is really fascinating. It's a coenzyme that has been suggested to be helpful in mitochondrial function and egg division and egg quality. I put every patient who's over the age of 30 on a CoQ10 supplement, which is typically 200 milligrams. That's where the pills come 2 or 3 times a day. It has relatively few side effects. It's really well tolerated. It potentially can help with how your eggs are functioning. Overall, CoQ10 is considered an antioxidant, and this is not bad for your body. So for me, anybody who has signs of ovarian aging, a low AMH, potentially is going to have an issue with egg quality, we add CoQ10 on. So diseases like endometriosis, low ovarian reserve, or older age. I also, for endometriosis, like to add in other antioxidants such as vitamin C and E. Again, if you're taking a prenatal, those are probably included, but if you're not, you'll want to look at taking those separately to try to just help lower that oxidative stress on your body. If you have low reserve, you may be recommended to take DHEA. Now, DHEA, this is super controversial. It's a hormone precursor and it's helpful in early follicular development. So in some women with very low critical reserve, pre-treating with DHEA may help build up the stores that are recruiting follicles from the early stages or help get more follicles to maturity. It is not a benign medication, it's an androgen. So women who take DHEA are going to have oily skin, oily hair, increase in acne, and it hasn't been correlated quite as strongly with an improvement in outcome, although it has been suggested in some studies. I usually put my severely critically low AMH, low ovarian reserve, older age patients on DHEA unless they otherwise have signs of high androgens. PCOS patients who have high androgens do not need DHEA. Previously, insulin resistance has been treated with metformin. So insulin resistance is very common in women with PCOS. Myoinositol and inositols have been other insulin sensitizing agents that help with insulin resistance that don't have quite the side effects of metformin and have been shown to improve reproductive outcomes in patients with PCOS. So I usually recommend inositols for most of my patients with PCOS, and that's because reducing insulin resistance is one key feature we can try to help when we treat this disease. When we start talking about supplements, there's so much out there. You definitely do not need a birth control pill cleanse. You don't need a cleanse of any time. For most of your life, you should be able to get most of your vitamins and minerals and nutrients from eating a really whole food-based diet. We want to supplement when you're trying to get pregnant with anything you could need that possibly could help your chances of getting pregnant. Things that I didn't go over, there are things that cause more harm than good. So we certainly don't want to be in a place where we're taking things that are going to negatively impact our chance of getting pregnant. Just because it's natural doesn't mean it's good. Would love to know what questions you have about supplements. I have an entire video on diet, so if you want to know more about fertility and diet, feel free to go ahead and check that out. As always, love it if you subscribe to the channel. You can follow me on Instagram at Natalie Crawford MD, and you can listen to the As a Woman podcast for more information coming your way. Thanks, friends.